Thank you all for tuning in to the High Levels with Shay Show. I am your host, Shay Gill, and this is part 3 of our 5-part series right here on the Kingdom Purpose Television app, Kingdom Purpose Radio, as we are broadcasting on that platform right here on the High Levels with Shay Show. Okay, so our last 2 episodes, one was based off of cancer. The other one, we discussed female reproductive issues. We discussed infertility. We discussed fibroids. We discussed so much about the female reproductive system, PCOS, and more. And we also gave away herbal remedies for women who have issues with difficult menstrual cycles, pain, foul odor, so much more. It was such an amazing show. So if you did not have the opportunity to catch those shows live, don't worry. We do have the replays on YouTube at High Levels with Shay, also on the Kingdom Purpose Radio app, where you can download the app, follow High Levels with Shay Show, and click on demand, where you can find these last 2 episodes that I am currently discussing, in addition to previous episodes. Now, today, men. Today's show is dedicated to our men, and we will be discussing male reproductive issues, causes, signs and symptoms, and herbal treatments. Now, with the men, those diagnoses that we'll be discussing consist of decreased libido, erectile dysfunction, prostate issues. We're going to also talk about how to enlarge and strengthen the penis. We're also going to talk about how to improve your sperm and increase your sperm count and vitality. All of that and more coming up right here on the High Levels with Shay Show. Keep in mind, this is part 2 of a show that was previously recorded. So the questions and the comments are not live in this show. However, feel free to comment, feel free to email, feel free to give your testimony in the comments as you are enjoying this show. God bless you, and I hope you all enjoy it. Tomorrow, we're going to have so much more that we are going to be discussing. And don't forget, Friday is a special topic. So stay tuned in, stay connected right here with us on the High Levels with Shay Show. Let's get into it. Thank you all, and God bless. So let's get into the men. Sorry, man, we're going to get into you. So on this screen behind me, we're going to talk about the male reproductive system. We have the testicles, or what I like to call gonads. And gonads are your testicles, and it's inside of a sac called the scrotum. So the testicles, gonads, inside of the scrotum sac. Let me see. You have your penis, the penile shaft, your ductus deferens, your bladder, the prostate, the urethra, and your epididymis. Okay, so your epididymis, that helps with the excretion of your semen, and it goes up through the vas deferens, because the vas deferens is not actually on here, but you have that epididymis, and what that does is it helps with the liquid part, like the thick liquid part, and like the sperm, the fertility of your semen for the men. And then it goes through the vas deferens, and then through the ductus deferens, and then out, and then you ejaculate it out. All right. So, and there's a reason why I'm mentioning the vas deferens, is because a lot of men, they get vasectomies, and what you don't realize is that is what's being cut. Is your vas deferens is being cut. Okay. The vas deferens is being cut because that's what's preventing the fertile fluid, the fluid that makes you fertile, that makes the semen fertile. It prevents that from making it fertile. So that's why men who have vasectomy, they're still able to ejaculate and they're still able to produce, but it is missing the substance that actually makes it fertile. So that's why I decided to mention the vas deferens in there. Okay. The prostate gland produces the thin, milky substance, and then that bulbal urethral, that you see the uterus like going up through the prostate. The prostate gland produces the thin, milky substance, and that's alkalinic. So does the bulbal urethral. That also is very alkalinic. And if y'all remember, we saw the acid-base balance. Acid meaning acidic. Base is alkalinic or alkaline. So you got this. So why is it that the female's vagina is acidic and the male's secretion is alkalinic? There you go. Isn't that a good balance? So when the man ejaculates into the female vagina, not only is it helping the sperm to maneuver through the vagina so that it can properly fertilize the ovary, the ovum, but it's also protecting the sperm from dying, because technically without it being alkalinic, the female vagina will be so acidic it will actually kill the sperm before it even reaches the uterus to fertilize. All right. And men in here, I want y'all to make sure y'all are commenting, make sure y'all have any questions. You know, don't be afraid. We all one body, one family here. So don't be afraid to join in on the live and put y'all comments. We had the women participating. So if y'all want to join in, please do. Women, if you know men who can benefit from this information, we're going to talk erectile dysfunction, BPH. We're going to be talking about PRIAPISM, and PRIAPISM is when your penis is too hard for too long. And we're going to talk about infertility in men and how to strengthen the penis. Okay. So if y'all know any man who could benefit from this live, please share it with them. Please share. So just like women has hormones, male does too. They have testosterone and they have a sex hormone called androgens. No. So at puberty, you know, the testosterone level increases, and then once you hit puberty, males, that's when your semen is able to, the secretions of your semen is able to become more fertile. They start gaining pecs, they start getting pelvic muscles, and they start getting that facial hair, and then the sperm count actually starts to increase. Now, normal sperm count in men should be 100 million per ml. So every ejaculation, a man should be producing 100 million sperm cells. How does men know that they're infertile? Because the first one time is infertility. I told you the men are going to be easy because that's all it is, really. What is going on with men is if your sperm count is less than 20 million, why I keep urinating at night and early morning, just asking. Perfect. So for you, Dino, who just asked that question, we're going to go through this, and I want y'all comments. I encourage comments. I encourage y'all to interact. I'm going to get into that. We're going to discuss about urination. What I'm going to do is go over infertility first, and then we're going to do erectile dysfunction, and then we're going to do BPH, and we're going to talk about that, okay? Yes, 20 million to 10 million. Yes, absolutely. So if your sperm count is 100 million, it should be more than 100 million. But they start to classify you as infertile if you are producing less than 20 million or 20 million or less. 20 million or less. Some of the reasons that causes men's infertility is, one thing's for sure is that you guys have a hormone stimulant. It's called the GnRH. Okay? And that's your gonadotropin releasing hormone. Gonadotropin releasing hormone. Okay? Now that is the hormone that tells your body that it's time to reproduce. You know what I mean? So if you have an imbalance in that, and that is from your hypothalamus, and that is mainly excreted and controlled by your hypothalamus and your pituitary. Okay? So if you have an impaired imbalance with your impaired function with your hypothalamus pituitary, then that could be one reason. Okay. Another reason is men wearing really tight briefs and underwear and really tight pants or leggings. You know, we gotta say it all. So if you're wearing really tight garments, that can lead to infertility. Why does really tight garments lead to infertility? Well, because your body, again, our body's temperature is 98.6. The reason why your scrotum sits, the reason why your scrotum sits so low outside of your body. Realize women's organs are inside. Our organs are inside. Men, your organs are outside of your body. The reason why yours is outside of your body is because you're not supposed to, your scrotum and your sperm is not supposed to be at that 98.9. It's not supposed to be at that hot temperature. Your body is purposely designed to be away so that your testicles can stay cool enough while they're housing your sperm. So when it's time to ejaculate, then it's strong enough and it's potent enough to be able to fertilize and reproduce. So when you're wearing tight garments and they're so high up on your body, now you are exposing them to elevated temperatures that they're not used to. So you're causing yourself infertility. Caffeine use, the same thing with women. One of the main things with men, and it was a research, was Mountain Dew. Mountain Dew, but all soda. All soda has caffeine in it, can cause infertility. Overuse of caffeine, chocolates, teas can cause infertility in men. Obstruction can cause infertility in men. And by obstruction, we'll get into BPH and erectile dysfunction. But before that, we're talking about men getting hit in the penis. So women, let's be clear. We cannot hit men we can't hit men in their reproductive organs. It causes infertility. Okay? Men who fight and hit other men, stop doing that. It causes infertility. Men, if you're climbing on ladders or you're doing you're doing things that can, cause you to hit your reproductive organ, be careful because it causes infertility. Okay? My fiance urinates constantly at night. He says, yep, we'll talk the constant urination. We'll talk about that. So I want to just touch on infertility as a whole first, and we'll go into that. Aging, that's obviously one. Aging is going to cause infertility. We all know that. Prostate enlargement causes infertility, and we'll get into BPH. But how does prostate enlargement cause infertility? Is because the prostate, when it's, as you see on this graph, that's what the prostate is up there, right here. So the same thing with bladder. So for the women and men who are in the comment, here's your answer to that question. Well, I got to talk to you, sir, first to see. But when the prostate is starting to get enlarged, it squeezes on this urethra, right? So this urethra is this long opening right here. And as you know, with the men, they only have one opening. Well, women, we have multiple openings. They urinate and they ejaculate out of the same opening. So when that prostate, that little walnut-shaped organ is really light. I hope y'all can see it, but it's right behind the urethra. But when that is enlarged, it compresses on that urethra. And so when the bladder is trying to urinate, you will have a frequent urination because your brain is constantly telling your bladder is constantly telling your brain that it has to urinate. But if you have an obstruction, if you have erectile dysfunction, if you have BPH or injury to the male organ, then you're causing an obstruction along the route of the urinary stream to be able to excrete completely. So I'm gonna move over here a little bit since we're done with the women. That way the men can see their graph. Okay. So if you're constantly urinating throughout the night, men, my first question gonna be to you is how much water do you drink? How much cranberry water do you drink? I'm gonna ask them, are you completely urinating? When you urinate, are you making sure your bladder is completely empty, or is it more so like just a little drip and that's it? Also, constant urination, whether it's with men or female, and constant thirst. I'm gonna start asking you about your food intake. Food intake, because that's a sign of diabetes. If you're constantly having to urinate and you're constantly are thirsty, man, I'm going to ask you your blood sugar. I'm going to ask you, are you a diabetic? All right. So just an FYI for the lady who was in the comment, for the young lady in the comment who asked about Nino, let me know if I answered your question, or Dino, let me know if I answered your question. For the young lady in the comment who said her husband frequently urinates at night, ask him, is it painful during urination? Let's talk about this. That's what I didn't get to. Sorry, I skipped a little bit before I start getting into the abnormalities. I'll get into the normalcy of it. Men, when you're urinating, again, same as I was telling women, you should not have a foul odor. It is completely abnormal to have a foul odor when you're urinating. Okay? All right, thank you. So he said, yes, you did answer. You should not have a foul odor. It is not common for your semen to smell odorous. It is not common for your semen to be discolored. You should not have a discharge. When you're urinating, men, and women, the characteristics, please pay attention to the characteristics. The characteristics of proper urination should be a straw color to a light, to clear. Straw color to clear. Now, I'm making the point to say this. If you're urinating and your urine is yellow and it's like, or darker yellow, then and you're urinating in a toilet that already has water in it, which means it's being mixed and diluted, then that should be a heavy concern for you. Because if it's yellow, dark yellow, and it's already in water, then what does that look like if it wasn't in water? You see what I'm saying? So these are some things I want you to be careful with. It shouldn't burn. It shouldn't itch. It shouldn't be discomfort. You shouldn't have to force it out like a forceful stream. And you're like, ugh. Now, does that come with age? Yes. But we're talking about 50, 60, 70, 80-year-old age. If you're in your 20s and your 30s and you're having difficulty urinating, then I highly suggest you go and see a physician. Don't be afraid to get those diagnostic exams, like the prostate exam or digital rectal exam. It's very important. I'd rather you have a little bit of 10-minute discomfort than years and years of discomfort that could ultimately lead to a life-changing, non-reversible situation. Okay? For the men. So I really want y'all to be comfortable and take care of yourselves, okay? Your urine you should be urinating at least 30 cc's an hour. So 30, and so basically be mindful of what the drinks that you intake, that should be how much you excrete. If you're not sure about your bladder, men, when I say make sure your bladder is being empty, palpate on your bladder and see. You see what I mean? And if it feels flat, like feel yourself now. If you don't have to use the bathroom right now, everybody, just palpate on your bladder. If it feels all squishy, like it can go in, then okay, then you're fine. But if it's still bulging and you feel like it's still not completely empty, but you just tried to go and there was nothing else to go, then there's an obstruction. There's an obstruction going on. For those men who, and the reason I brought up the amount of urine you should have, because there is a thing called alliguria and anuria. Alliguria means little to no urine. Little to no urine. So you keep getting this urge to want to urinate. You keep running to the bathroom because you have to go, but it's hard, but you're not really producing a lot of urine. That is not normal. Go seek assistance. Go seek medical assistance. For if you are not producing urine at all, go seek assistance because you should be urinating. Okay? You should be, every time you drink something, you should be urinating. Even when you don't drink anything. Urination and kidney function is one of those things that you should still consistently have. How many of us have urinated and we realize we haven't drank anything all day? You see what I'm saying? So regardless of whether you drink anything or not, you should still be urinating. Okay? So it should not be normal to have one urinary period a day or one urinary cycle a day. That is not normal. It's not normal to have 2 urinary cycles a day. That is not normal. That is not normal. And so I want to make sure that I get on here and say that, because when I ask my patients, how's your normal urinary cycle? And they go, oh, it's normal. Then I say, well, okay, well, how many cycles a day are you having? 1, 2. That's not normal. For those who are holding their urine and they say, well, it's because I work, I'm a truck driver, I work long hours, and so I can hold it. I can hold it for a really long time. What you're doing is you don't want muscle atrophy. You don't want to have bladder atrophy.
at an early age. Now, this is already promised to you when you get 70 and 80 and 90. You don't want to be in your 50s because you're still very young. You don't want to be in your 50s and in 40s, and you don't like stressing out your bladder muscle in your 20s and 30s. Women, we are notorious as well, working all extensive jobs, and we hold our urine. Listen to your body and go to the restroom. Men, go to the restroom, and you guys have it easy. It's easier for you to use it anywhere than it is for women to use it anywhere. So if you feel yourself having the urge to go, I highly encourage you to go. Do not hold it. You do not want to kind of like expedite your aging process, because you're going to get there when you're 70 and 80, dripping urination, decreasing sexual drive, decreasing semen production, decreasing urinate output, frequent urinate accidents. That's already coming to us at 70 and 80. You don't want to be going through this in your 50s and you're still young and trying to vacation and you in a Bahamas somewhere and you can't hold it because of what you did in your 20s and 30s. So I'm telling you now ahead of time so that you can at least arm yourself with this information and this knowledge. Okay. All right. So let's get into some of the causes of infertility. Well, I'll talk about some of the causes, but another thing I want to talk about is alcoholism, drug abuse, and medication, overuse of medication. There are some medications, including diabetes medication and blood pressure medications. So men, I'm not telling you not to take your medicine. I'm telling you this so that you can know how to take care of yourself holistically, how one issue can lead to another. So make that clear. I'm not telling you to take your medication. Treat the hypertension, heal yourself of the hypertension, heal yourself of the diabetes so that you can get off the medication that can lead to infertility. Okay? Or abnormal urination cycles. You see what I'm saying? So, yes. Now, before we get to erectile dysfunction, men, do we have any questions about infertility? Do we have any questions about male reproductive organs? We talk about their functions, but do we have anything in here for you? Because we're gonna get to different herbs. Because I know somebody probably thinking, oh, y'all just now joining in, but we're gonna talk about different herbs that you all can take, fruits, vegetables that I highly encourage y'all to eat, men, so y'all can help with strengthening your penis, strengthening the blood flow to your penis. And by strengthening the blood flow to your penis, you're going to make your penis larger, because this shaft, and y'all see the tissue that's in that dark red, not the uterus, but right here on this side, the outer line, though that muscle supplies and houses blood. So the more blood to that area, the larger your penis can grow. The stronger, and it is a muscle. So just like lifting weights, the stronger that muscle is, the more girth and stronger your penis is. So we're going to talk about all those things for men, okay? But before we get on to erectile dysfunction, are there any questions? Any questions? I'll give y'all some time to type it up in the comment, but I want the men not to be shy. Come on and, say something. Any women in the comments who got a question about their significant other, their son, their father, grandfather, any questions? I'm opening up to the women now because I think the men are a little bit shy. All right. All right, man. So y'all make sure y'all hold on so y'all can get those herbs and those exercises that can help strengthen y'all. Women, I didn't give y'all exercises. Kegel exercises. We know about Kegel exercises. I'm sorry, women, and I didn't give y'all the tightening of the vagina exercises. I'm sorry, women. I'm teaching the men how to strengthen their penises, and I didn't even tell y'all the herb to help y'all strengthen y'all vagina. And I told y'all the herbs, but I didn't tell you how to use those herbs to strengthen the vagina and how to do your Kegel exercise. So pause for 2 seconds, men. Sorry. Women, those herbs that I gave y'all, if y'all put those in a pot of boiling water and sit on top of it with like a cloth, like a long skirt, and let it seep. Those things will strengthen your vagina. And doing your cable exercises. You do your cable exercises by and strengthening that muscle by if you are peeing. Think about if you peeing and then you're trying to stop a stream and you like really just sucking in and holding in and tightening at that muscle. You do that for 5 seconds, then 10 seconds, then 20 seconds. That's gonna strengthen your vaginal walls. The blood flow to your vagina. Eating beets, the same fruits that I'm gonna give men to help strengthen their penile muscle is the same thing that can strengthen your vaginal wall muscles. So like the beets, the strawberries, all those different fruits I want to give the men, y'all hold on for that as well. If you miss the herbs or if you missed anything, for women, we talked about a lot for women, but if y'all missed that, go follow my YouTube channel and subscribe at Higher Levels with Shay because this video will be posted. We talked about PCOS, fibroids, infertility, menopause, breast lumps. We talked about everything for women. We talked about menstrual cycles, normal cycles. We talked about it all, and we talked about different herbs to cure yourselves and how to do so. But I forgot the exercises. So the Kegel exercises, letting your vagina breathe. Stop wearing panties all day. Wear a skirt. Let yourself breathe, and then make sure you put, when you have those herbs, in a pot of boiling water, like steaming. You sit on top of a chair, not on top of the pot, because I don't want you to burn yourself. But sit over it, like you're hovering over it, and then you sit with like a sheet, and just sit there about 20 to 30 minutes a day. Those things will tighten you up, and it do you well. Pineapples helps with increasing vaginal secretions. So beets help with increasing vaginal secretions. So you're more lube, you're more tight, and doing your Kegel exercises, you can do it every single day, all day. Men, you got to be somewhere private to do your exercises. But women, you can do them all day, every day. You see what I'm saying? The herbs, the same herbs that we mentioned when we was talking about in the beginning, well, not the beginning, but the middle of this live. Go to my YouTube channel. I will be posting this. On my YouTube channel at Higher Levels with Shay, but I got to get back to the men because they've been waiting all day. Us women was talking for like an hour and a half. So back to the men. So now we're going to talk about erectile dysfunction. So erectile dysfunction, first of all, what is erectile dysfunction? First of all, it's the inability to achieve or maintain an erection for longer than 25 to 50% of its time. So meaning 25 to 50%, the 25 to 50% of intercourse. So if you can't stay well endowed or erect for either the entire duration of the intercourse, or if you can't get erect at all, then that is considered erectile dysfunction. Some causes of erectile dysfunction is, believe it or not, liver disease, kidney disease can cause erectile dysfunction, diabetes, and these are because of the medications. Endocrine disorder, your hypothalamus, your pituitary disorder. Those are some things that can cause erectile dysfunction. What about the overuse of, and this is what I want to say, especially to you younger men who are on here, those gas station pills, somebody said something about honey packs. What else is going on out here? It's just so much that the youth is just doing because it's a trend. And I'm just like, you all have to be mindful that you're doing your body more harm than good. When you are, first of all, taking drugs and alcohol, period, is bad for your body. But when you are excessively using it for fun and for excitement right now, you're going to be 35 and 40 years old, not being able to have an erection because now your body has become so accustomed to this substitute in his body that's helping it, that it feel like they don't need to work that hard. I don't need to work that hard. So then when you get done using it, or Viagra, overuse of Viagra when you don't even need it, can lead to erectile dysfunction, because your body is properly functioning and then you're giving it a booster, an overstimulator, and what you're doing is you're making your body lazy. You're telling your body it doesn't need it. I don't need to work that hard. It become dependent on it. Somebody said dependency on it. Yes, it become dependent on it. So when it says medication use can cause erectile dysfunction, I have to just throw that one out there. It's not all about blood pressure medicine and diabetes medicine and liver decreased function and all that. It's about those Viagras and those gas station pills and all this stuff people doing now. I see these young boys about these packs, and I'm just like, what? Do you not know what's gonna happen to you when you're 35? When you're 40? And you realize that the fun you was trying to have in your 20s has now caused detriment to you later on. But the beauty is there are herbs that can help. There are natural remedies that God has given us right here on earth that can help. So that's the beauty. But the real beauty is knowledge. The real beauty is knowledge. Arm yourself with this knowledge and stop doing it. Just stop doing it. If you need the Viagra, make sure that you don't have any heart issues. By the way, man, make sure that when I'm giving you these herbs, do your due diligence, do your research, because herbs can counteract with other medications. They could also interact with certain disease processes. So do your own research on the herbs. What is safe to do is the exercise that I'm going to give you in the fruits and vegetables. When we're talking about the herbs, I don't know your allergies. I don't know your medical diagnostic history. So do your own due diligence. All right. All right. So those are some causes of erectile dysfunction. So we already talked about that. Now, the Midwestern way to treat yourself of erectile dysfunction, they're putting tubes in your urethra to help still. They're putting rods up there. They're doing all type of surgical procedures for you to cure yourself and be treated of erectile dysfunction. But you can sit here and just learn the natural way and not even have to go through that. You don't want to go through no vacuum constrictive devices that they're putting up there. It's a lot that men got to go through to heal themselves of the erectile dysfunction. And I just rather just tell y'all the more holistic way, and we'll go from there. Spermicide. If y'all men are using condoms, how can I say this? Make sure y'all get the condoms what's those condoms called? The skin bare condoms. Those skin bare condoms and those I won't say I won't recommend, but they are full of spermicide. So you gotta think about it like this. If you're already exposing yourself to spermicide, which spermicide means killing of sperm. So you're exposing yourself to killing your sperm, then what do you think long-term exposure is going to do to your body internally? So be mindful of that. If you're going to wear a condom, I know it's a little bit more expensive, but get the lamb skin. Get the lamb skin if you're going to. I know it's a little expensive, but I know that's expensive. So if you gotta get the other condoms that does have the spermicide in it, just be mindful of overuse. I don't want you not to use condoms, but be responsible when you have every single sexual intercourse, but also keep in mind of the overuse of these spermicidal condoms. You see what I'm saying? Spermicide cream. Let's say there's men, and let's just be honest here. We got men who don't like using condoms at all. So you get that spermicide cream that they'll rub on their shaft or they'll put into the woman's vagina to help prevent pregnancy. You're still exposing yourself and you're causing yourself to have infertility. You see what I'm saying? Absolutely. Somebody said, is that the equivalence to birth control use? Absolutely. That's the equivalence to birth control use for women. Overuse of birth control use for women causes infertility, just the same as spermicide creams, spermicide condoms can cause infertility in men. So I don't want y'all to think I'm telling you to be safe. What I'm saying is choose one sexual partner, go get tested together, and just be mindful of what you're doing to your body, because it is their responsibility to tell us, but it's also our responsibility to arm ourselves with this knowledge as well. People don't understand this. And I think that here's why I would think people don't understand or they don't grasp the information. What I've noticed in my 15 years of my medical field career is when people come into that office, they immediately intimidated. They immediately nervous and they get embarrassed for some reason. So they're not as open to being transparent about the signs and symptoms that they're experiencing. And they're not completely transparent to talking about what the lifestyle that they're living, but they only harming themselves. Why come to the doctor if you're not going to be open to get this all the help that you need? You see what I'm saying? You should want to maximize your time and maximize your knowledge when you're in that office. And so a lot of people don't do that. So that is what I've noticed in my career. But this is what I want to say. This is why I get on here and do these lives. It's because you're in the comfort of your own home, and I'm just giving out information, whether it applies to you or not. You're still willing to absorb the information versus you coming into an office to get this information, or you come into the hospital and then I got to read discharge information to you and educating you during your discharge process. You are less likely to ask questions. You're shut down. You're not really grasping the information as a whole because you're just ready to get home, or you're ready to get your antibiotics and go about your way. So I don't think they're not listening because they don't want to. I think it's the environment. I honestly think that it's the environment, because I find myself doing these lives, or if I'm just hanging out and somebody asks me a question. Let's say I'm hanging out with a group of friends and one guy asks me a question because I'm in the medical field. I can guarantee you about 7 guys standing behind me listening. They're not going to come to the forefront and sit down and say, hey, you know what? But they right there behind me and they just listening. And I'm like, oh, y'all okay? Yeah, we good. We just listening. So it's more so I think it's just the environment. Creating a safe space for them to feel comfortable. And nobody is comfortable in the doctor's office for real. And nobody's comfortable in the hospital, seriously. So I think that's what it is. And that's why I get on here and do these lives. So, and if you're just getting in, somebody just say they're just now tuning in, you can find, we cover women's issues, we're covering men issues now. We talk about herbs and healing processes. You can go to my YouTube channel and follow me at Higher Levels of Shade and subscribe to my YouTube channel, because I do post all of my videos. I go live Tuesdays, Saturdays, and Sundays. I'm going to start adding more days. I used to do once a week. Then I was doing twice a week. Now 3 times a week. I may start doing 4 times a week. I do, you know what I mean? But I do Tuesdays, Saturdays, and Sundays. I go live talking about one certain disease process, and then we elaborate on it, or a body system, and we elaborate on it. And then I post those videos to my YouTube channel. So y'all go subscribe to my YouTube channel at Higher Levels with Shay. And I think I'm gonna start going live on YouTube too. But I like this because I get more interaction. You know what I mean? All right. So before we get to PRIAPISM, let's go to these comments. I'm seeing a lot of comments starting to pop up. They say this is very important. Thank you. I feel we are misled when it comes to birth control and medicines that's prescribed by doctors. I'm going to touch on that in just a second. What was the next comment? It's crazy because most doctors don't even tell you about herbs. They want you to keep coming back. Well, I'm going to address both of those comments. And this is my opinion. I don't have a bunch of doctors telling me this. This is just my opinion, guys. One thing, yes, the short answer is yes. It is very misleading about contraception. Now, they tell you in the package, that's why I say yes and no. They tell you in the package, it could lead to infertility, to cancer, to this, to that, to that. It's all on the package. So I can't say it's misleading because it's right there on the information. But a lot of doctors, not all, purposely don't put that information out there because the big makers don't want that information to be out there, because the objective is population control. That's the objective. And that's just being transparent. The objective is population control. Think about it. If I came to you and I said, hey, I know you're trying to go to school. I know you got 3 kids, sir. This right here, this spermicide could help you in the next couple of years. So the 4 years you're in college, you don't have to worry about having kids. Focus on your career. But I know that those 4 years of use can cause long-term infertility. But my long-term goal, I don't care about you finishing college. I don't care about you really stressing out about life with your 3 kids and possibly having a 4th one. I care about population control. I care about the monetary value. I care about the profit. Do you see what I'm saying? So on one hand, it's misleading, but on the other hand, it's on the packages. You see what I'm saying? But it's just worded in jargon that they know people are not going to research and not going to care to understand or tap into. You see what I mean? So That's why on these lives, if y'all see me pausing or going a lot, I'm trying to make sure that I'm using layman's terms. I'm trying to make sure that I get this information out as simplistic as possible so that y'all are educated. You see what I'm saying? You see what I mean? Now, somebody else, what was your comment? It said it's crazy because most I don't even tell you about herbs. Now, that was the next comment I was gonna attack. A lot of people don't know about it. They can't teach you what they don't know. They're in school one semester, half of a semester about nutrition and herbs, and 3 years about pharmacology. So they can't. If you notice that physicians, when they ask you about dietary changes, the first they say was, let me refer you to a nutritionalist. They are practicing medicine, pharmaceutical medicines. It's not called the practice of holistic care or the practice of herbal. It's the practice of pharmaceutical medicines. And then they send you to a nutritionalist. So they can't educate you on what they don't know. Now, there are some physicians that they are amazing when it comes to nutrition. So I don't want to say that. But if you're going to the doctor thinking that a primary Midwestern physician thinking that they're going to tell you a holistic way of curing something, then you're in the wrong place. You need to go to a herbalist, a holistic doctor, a holistic specialist to get that kind of information. Come on my labs. I'll tell you as much as I know because I'm still learning myself. I've been doing this for 3 years. There's herbalists they've been doing this for 14, 15 years, and they teaching me even more stuff. They tell me which herb and concoction works best to do this, and you get a better benefit. You mix this with that. Instead of using distilled vinegar, use this glycerin. It helps to increase this. There are still things that I'm learning on my journey from those more seasoned herbalists. You see what I mean? So I'm teaching y'all where I know from the level that I am. But guarantee I'm going to climb higher. And then the higher I climb, the more I'm going to teach y'all as well. All right? All right. So if that's it with the man with the questions, we are going to get into, you're welcome. Now, what is priapism? Now, priapism at first sounds like it's a great thing, but it's actually extremely painful for men. Priapism is long-term hardening of the penis, a long-term erection. It can be caused because of the blood flow. It can be caused of increased hormones, or it can also be caused by what's it called? Viagra. The YouTube was higher levels with shade. So my YouTube channel is higher levels with shade, the same thing as this channel here. And the same thing as my podcast. Podcast, higher levels with shade. I'm on Tuesdays, Saturdays, and Sundays live here. On Mondays, I'm on KP Radio and KP TV. And on Fridays, for the next 5 weeks, I'll be on Just Faith TV at 5 p.m. So 10 a.m. Central Standard Time, I'm on KP Radio and KP Television. I'm on here Tuesdays, Saturdays, and Sundays. And then on Fridays, I'm on Just Faith TV for the next 5 weeks at 5 p.m. Central Standard Time. Okay. Now, let's get into priapism again. So, yeah, that's yeah. So, here's the thing about that. That can be caused from a neurological issue or a vascular issue, right? So neurological issue, vascular issues can cause priapism. Now, Viagra use can cause priapism. All right. I know a lot of people, think that that's a great thing, but for men, that can be extremely uncomfortable and extremely, extremely, extremely painful. It makes your penis swollen. Your shaft is throbbing. You can't get your erection down. It's constant blood flow. So it's kind of like, if you think about it, it's kind of like a migraine headache. Constant pressure. And like just the smallest amount of noise when you have a migraine headache just causes impeding, this pounding sensation in your head. Men in the penis, when they have priapism, they're going through the same thing. Every little touch is just gonna hurt because your penis is sore. And then once that erection has gone down, because it has been erect for so long, it's gonna you're gonna have soreness in your penis area. Now, what that can lead to, what I don't want anybody to have, is it can lead to discomfort during urination. That can lead to what is considered a limp penis. okay? And which is called what is called pyrones, which is called a limp. You know, if the shaft is so limp because it's been strong for so long, then it just go like a flaccid. It's just more like flaccid. I use the word flaccid in the medical term. It's called flaccid, or you can say limp. You know what I mean? So it'll cause a limp penis. It's called soreness. It causes aches. It can cause pustule discharge. It can cause a lot of things. Okay. Now, when you're thinking about the Midwestern way, how to treat this, of course, they're gonna want to dilate. They're gonna want to mechanically and alternatively dilate the vessels. But we're gonna give y'all some herbs that you all can take right here, men, for those treatments. And we're not gonna talk about the medicinal Midwestern way. We're gonna talk the holistic way. Okay. The next thing I'm talking about is BPH. Now, what we already discussed is BPH. We already talked about the prostate, and it's called benign because it's non-cancerous. So malignancy is cancerous, benign means non-cancerous. So that is a swelling of the prostate gland. Swelling of the prostate glands, and that is, occurs when the endocrine glands are not properly functioning. So improper function of the endocrine system. Okay, it causes your prostate to become enlarged. That also comes with aging. It comes with aging, and men who are at risk between the age of 60 and 75 are more at risk for BPH. You don't notice, and I'll take this, you don't notice the signs and symptoms of BPH until you have an issue with urination. Not necessarily with ejaculation at first, but with urination first, then later ejaculation. Difficulties not only passing urine, but completely emptying your bowels. Then you start to notice that your testicles are becoming a lot larger. Your scrotum. Now the scrotum is typically kind of like a rigid, kind of wrinkled scrotum, but with BPH, it becomes extremely smooth because the scrotum is now being enlarged. You see what I'm saying? Because of the BPH, it's exceeding. I mean, it's exceeding downward, and when it exceeds downward, now your scrotum is enlarged, and so it begins to become smoother. It's really huge. You can't fit them into your underwear. Those are some of the signs of BPH. Those are not normal findings. If you are constantly feeling like you have to urinate, but you can't pass your urine, that is not normal. If you start having burning sensation, that is not normal. If you start having a frequent UTI, well, I don't want to say frequent. If you begin to have UTIs in general, get yourself checked, because UTIs are not normal. Urinary tract infection, to be exact. Men, the proper way to clean your penis. This is for circumcised men first. Then we talk uncircumcised men. If you're not circumcised, meaning you still kept the natural extra skin fold over your penis, which is actually the natural way it's supposed to be, because the same way the women has the labia minora and the labia majora, meaning the lips, to protect their vaginal hole and their uterus hole, men, you're supposed to have that extra hair because it's protecting your urethra. You see what I'm saying? I'll tell y'all what I'm okay. Now I'm about to jump into the gym. I don't want to get too real here, but I gotta be honest. Y'all. When they take the foreskin of babies, those are actual like stem cells, especially African American babies. So when you get a circumcision and that foreskin of the baby skin, they take that and they spin it and they reproduce it and use it for other things. They don't discard it. So it is heavily pushed for African American men to get circumcised, because those cells are like stem cells, and they reproduce and they like heal skins. They help with anti-aging. It's a lot of things. So I just wanted to say that it is not normal. You should not. I do not recommend anybody to get their child circumcised. That's like cutting off the lips of a woman's vagina. It was meant to be there for a reason. It is a protective mechanism, just an FYI. So now for circumcised men, you're gonna pull back that extra, the extra meatus. and you're gonna clean. But when you're cleaning from the top of the head first. You're cleaning from the top of this head first, and then going downward towards your pubic hair area. Top of the head first, and then you're going downward. So you're gonna clean and then go down towards your pubic area. You're not gonna go from your pubic area to the front because you're pushing all that dirt that's rinsing off of your body into your penile hole, which can cause a UTI. Okay, men? Just an FYI. If you already have proper cleansing, they're not you. But if you don't, because a lot of men don't, they get in the shower and they clean and they go down. They clean it like that. And they'll pull the meatus back, the extra meatus back, and then they still rinsing downward. No, but you still can get that into the hole. It's supposed to be pointed upward, and then you clean it from the hole. So you go from the cleanest part all the way back down to the dirty. Okay. And you don't triple double wipe. Like if you urinate, and a lot of men use tissue after urinate, which is fine. I say use extra water to clean it. But if you're using tissue and you wiping it and you have the same tissue, then you're just contaminating yourself even more because you're putting that dirty tissue. So if you're gonna wipe, you pull the meat back, wipe around, then dump. Get some more tissue to wipe around and then dump, and then get you some water and properly clean yourself so that you don't have urinary tract infections, and then prevent yourself from getting other infections, and then leading to things such as prostate issues. Okay. All right. So back to BPH. Any questions so far before we start getting into these herbs for the men? Do we have any questions, men? We discussed BPH. The causes of it, which really is just a hormone imbalance and it's aging, really with BPH. But with the PRIAPISM and the erectile dysfunction and infertilities, those were a whole lot of other things that causes those, like the caffeine, overuse, drugs, alcohol, the overproduction of hormones, the different foods that we're eating, the overuse of erectile stimulating drugs like Viagra, UTIs, STDs, of course, from sexual partners or not properly cleaning yourselves. For the men who are cleaning them, who are circumcised, then of course you wouldn't have to. For the men who are circumcised, you wouldn't have to pull back on meatus. You don't have the extra meat, but you do have to clean yourself just as frequently as those men who are not circumcised because your uterine opening is a lot more exposed. And you're wearing those tight underwear or loose underwear, but whatever it is, you're more prone to getting bacteria up there because you don't have a protective shield over you. What is BPH? Okay, BPH, benign prostatic hyperplasia. That means enlarged prostate. This little pink walnut shape over here, and it constricts the men's from being able to urinate, and it constricts them from being able to properly ejaculate. So if you are just tuning in, welcome, and make sure y'all go to my YouTube channel at Higher Levels with Shay, because I will be posting this. If y'all are learning anything, tap in some hearts, double tap. If y'all are learning anything, I'll double tap the screen. Let me know y'all are here. Because, men, we getting ready to get into some exercises for your penis. And you can give us some fruits and some herbs for your penis. Double tap the screen if y'all are learning anything. I am here, and I really enjoy teaching this information. And I want y'all to get as much as y'all could. Double tap the screen if y'all are learning anything from this live. Anything y'all can share to y'all husbands, y'all children, y'all boyfriends, whatever, anything. And for the men who are commenting, I appreciate y'all transparency and getting on here and being vulnerable, because this is a safe space. Okay, Christine, you're tuning in. Please go to my YouTube channel. I will be posting this to my YouTube channel. Okay, we went over a lot. If you just tuned in, that means you missed a lot about the girls too. We talked about the females. We gave away herbs. We talked about fibroids, cysts, infertility, menopause, menstrual discomforts, UTIs. We talked a lot with the women too. Breast cysts, PCOS. We did a lot with the women. We're doing a lot with the men. So if you're just now tuning in, guys, make sure y'all follow my page, because I'll be doing diabetes and pancreas tomorrow. And then I will be putting this on my YouTube page. So okay, so why does the oh, where did they go? Okay, so I need you to elaborate just a little bit more. You can DM this to me and I'll see it pop up. I need to know, are you circumcised or uncircumcised? That's question number one. But if the skin is getting really, really tight at the tip of your penis, then that's like a heavy blood flow to that area. And I need to know, are you circumcised or uncircumcised? Because then that will tell me whether or not there's like an infection there. Because sometimes the skin will get really, really tight there, then you are having like a yeast infection, and it's trying to prevent it from getting into your body, like prevent whatever rash on your skin from getting into the meatus. So it's going to tighten and try to close up. So I need to know a little bit more about that question. And we say tightening, is it tightening when it's erect or non-erect? Because if it's non-erect and your skin is tightening, I need you to go and get that checked out. If it's erect and your skin is tightening, is it because of an overproduction of the like extra blood flow going to your body? Are you circumcised? So is it just the penile head that's getting tight, or are you uncircumcised? And are you saying that your penis is having a tough time getting through the skin because the skin is tightening up and closing? I need to know a little bit more about what that is that you're saying. You do not have to put that in the chat. You can DM me if you're not comfortable with talking about your anatomy here on the line. All right, gentlemen, and I want to give y'all these herbs because when you have erectile dysfunction and when you have BPH, there's so many surgeries got to do and so many tubes they want to put inside of you. And one thing I would say before we get to the herbs is, men, is I highly recommend, I know it's uncomfortable, get y'all digital rectal exams, do y'all prostatic exams, colonoscopy for all women and men, and y'all prostate exams. It is highly important for y'all to get y'all annual prostate, y'all rectal exams. Be uncomfortable for 10 minutes so they can save you a lifetime. In the meantime, before you even get to that, do your self-exams, man. We talked about this in my last lab when we talked about prostatic cancer, and we started finding tumors and stuff like that. When you are in the shower, matter of fact, I'm gonna get into the exercises while I'm here. We're gonna talk about how to strengthen your penis in the shower, and we're gonna talk about how to do your self-exams in the shower for the men. Okay. So well, James said annually. If you of age, yes, men, if you of age, get your annual digital exam. Yes, and go get checked. It's at a certain age, once you reach like 45, 50, 60, 70 years of age, go get checked. They tell you 60, 70, 80s, but I think that with the evolution, how the world's changed, that men need to get checked a lot sooner. Just like I told my last lab with my breast cancer, women need to get their mammograms a lot sooner, and men need to get their prostate checks a lot sooner. That older age, that should have been long gone. Once they saw that life was transitioning and the evolution of life and technology and radiation and everybody constantly getting cancer. So yes, man, sorry. Every year, hey, listen, everywhere women got to get pap smears every year. Yes, go get your rectum and your prostate checked. Yes. All right. Okay, then yes. So definitely hyperhydration. That's dry. That's kind of like a lot of dryness, sir. There's like a lot of dryness to that area. And your blood flow is more, which is healthy. You have a healthier blood flow than you have elasticity. All right. So I'm talking to you, sir. So you have more blood flow than you have elasticity. That's what that sounds like, since you just answered that question. So we're going to talk about what you can do for that. I got some herbs for you for that. Okay. Absolutely. My pleasure. I greatly appreciate it. All right. So men, okay. How to strengthen your penis in the shower. Before we talk about herbs, naturally for the women, we talked about Kegel exercises. We talked about the steaming over the bowl of herbs. But now for men, all right. Men, double tap this screen. Double tap the screen, meaning if y'all are ready, y'all ready to learn. Thank you, thank you, thank you. All right, so here we go. Now for the man, when you are in the shower, 2 things I want you to do, man. When you're in the shower, and it's when you're the most relaxed, you are going to massage and massage your testicles, and you are going to be assessing your testicles, your scrotum, one at a time, not both together. You're going to take your hand and you're going to do this to your hand, right? To the scrotum. You're going to feel for any lumps, any bumps, any abnormalities. You live in your body 24 hours a day. So you should be able to tell the difference in your size of your scrotum, okay? So you start to see your scrotum getting enlarged, more likely it's your prostate that's becoming enlarged and starting to push down on your scrotum, and that is not a good thing, okay? So you want to make sure that you're doing your annual exams. You can do it every single day in the shower, and I recommend a shower because that's when your scrotum is the most relaxed, okay? And so you're more likely to feel something if it's in the shower. Now, how to strengthen your penis muscle, because it is a muscle. What you want to do is you're going to get a warm towel, a heavy towel. Like, I mean, one of those really, really, really heavy towels. Really heavy towels. And you're going to wet it. And you're going to place it on your erect penis. And the same way you doing like push-ups, you got to push your body up. You're going to push your penis up at the same time. Now, if you're only doing it 2 or 3 times at first, then that's fine. That's normal. But you want to at least do that exercise at least 5 to 10 times. Okay? That is going to strengthen your penile muscle. You want to do it like 5 to 10 times per cycle. 5 to 10 times during per cycle. Okay? Now, I mean that per cycle means we're not going to over tire out the muscle. If you feel yourself becoming fatigued, then don't overexert yourself. Okay, you're gonna stop. You're gonna shower again later on at night. Do it again later on in the shower. You're gonna shower again in that morning. Do it again in the shower. Okay, so that's how you strengthen the muscle of the penis. You can also pull, not to where it's discomfort, but you can also pull on your penis like you're stretching out your penis. Okay, and just giving it a long massage. Okay. Not anything sexualized. This is just you massaging your muscle, okay? And relaxing your muscle. Thank y'all for the likes. Thank y'all for the gifts. That don't have any men of any, I don't care your sexual orientation. I do not care. If you have a penis, this is for you. This is for you. The ecstatic on whoever. Okay? So that's what you can do for those exercises for the men, all right? To strengthen it, all right? To strengthen it. Now, for the fruits that I want to talk about for the man first, before I get into the herbs, I want to talk about the fruits. The fruits that men and women, I think I did. For the women who need to know this information, here it goes. Beets. I know beets are not the most favorite fruit that everybody loves to have, but beets are notorious for red blood cell production and overstimulating the like opening up the hormones for libido, like increasing your sexual drive. It's beets, squash, zucchinis, berries. I'm talking about the men here. So we saw squash, zucchini, cucumbers, berries, beets, green apples. All right. All right, man. I hope y'all got those down. Those help. Drink your water, man. The same thing I told the women. Drink your water, drink your water, drink your water. Squash, zucchinis, green apples. Beets are amazing. The same thing that what pineapples do for women and what berries do for women. Beets do the same thing for men. Drink you some beet juice. You can drink get you some beet juice and put like strawberries and stuff in it. If y'all missed that website, the website was www.yafashakoor.com. Now, what that website has, they have a juice on there that contains beets in it, and it's for circulatory issues as a whole and detoxing and cleansing the blood as a whole, and which further increases libido, because the more blood flow you have to that area, like I said in the beginning when we first started talking about the men, the more blood flow you have to that area, of course, the more girth that you will have. But before you want to have you want to reproduce blood flow to that area, make sure you have a strong penis. Otherwise, you don't want to be erect, and you don't want to have too much of a blood flow to that area, and your penis muscle isn't strong enough, because then that can, you don't want to have any discomfort. Okay. Carrots are good. And carrots are good for the retina and the eye too. So carrots help with eye improvement and preventing impaired eyes. So I wanted to put that out there for the men, okay? Now, men, y'all write down these herbs. Make sure you remember to keep your testicles as far away from your body as possible. Meaning, be careful about the tight underwear, the tight pants. Be very, very mindful of those things, because you're gonna have your testicles so close to your body, and you don't want to cause yourself to have infertility. So these are just basic lifestyle changes that you can make. Change your diet. Be mindful of the food you put into your system. Be mindful of the lack of hydration, and be mindful of how close your testicles are to your body. Okay. Now, we gave y'all some fruits already and some vegetables, and they are very, very, very beneficial. Mushrooms, guys, mushrooms, turkey tail mushrooms, lion's mane mushrooms, reishi mushrooms, portobello mushrooms. I don't care how you want to consume it. You want to consume it dried up in a capsule, mushroom soup. Mushrooms are notorious, especially for men. Okay. Well, they help with the body in general, especially your neurovascular system as a whole. But they really, really, really help with the cell production and the neurovascular system and the flow. So mushrooms, okay? So if you like beets and you like mushrooms and all that good stuff and plantains, then you should be all right. I don't think I said plantain, but let me make sure I say plantains. All right, so guys, come on, write down these herbs, okay? So for erectile dysfunction, we have saw palmetto, SAWPALMETTO. We have ash, ASH. Ginseng, American ginseng to be exact. GINSENG to be exact. Flax. And you can put it in the oil, flaxseed oil. And for those who want to know how to prepare these herbs, we're going to do a live later on about, so make sure y'all following my page or subscribing to my YouTube channel at Higher Levels with Shay. We're going to be doing a live later on about how to make your own medicines. Okay? And grow your own, and how to grow your own herbs. False unicorn roots. All of those help with erectile dysfunction. Now, how to balance your hormone, because with the balance of the hormone, as we discussed, when you are imbalanced, you have infertility, and when you are imbalanced, you can have, of course, erectile dysfunction again, and you can have the priapism. Okay. Cook what you can cook with flaxseed oil. You can use flax, the herb itself, or get some flaxseed oil, and then you cook with the flaxseed oil. Like say, you want to eat spinach and you want to saute it in flaxseed oil. You see what I mean? Sage. This is for hormone balance. So ash, false unicorn root, sage, and flax. Now, impotency basically meaning infertility. All of them nearly the same thing. The same thing. Yes, sage. Especially if you're using like organic raw sage. Yep. Now, for those men who have not erectile dysfunction, but premature ejaculation. So those who have premature ejaculation, Solomon seal. Solomon seal. No, I didn't see that in the comments, but I just wanted to just say that just in case somebody wanted me to say that. So Solomon seal, if you have premature ejaculation and you want to strengthen that so that you can be able to have a more satisfying and long-term experience, then I'll say Solomon seal. Think about Solomon seal. You know what I mean? Thank you. You're doing a wonderful job. Lots of blessings. Thank you. Somebody said too much red meats. Absolutely. We talked about transition your whole diet. Take away red meats and processed foods at just period. Yes, Solomon, Solomon, Solomon seal. SOLO, yep, MON, Solomon's seal. Yes, that'll help with premature ejaculation. Yep. For those who are having the urinary issues or dribbling issues, false unicorn seal as well. Also, I want you to go to my YouTube channel and watch the one we talk about cancer, because when I was talking about prostate cancer and urinary discomfort, I gave away some herbs in there as well. Yep, Solomon seal helps with premature ejaculation. Sage helps with premature ejaculation. Yep. Helps with premature ejaculation. Now, another one I'll give you, and I want y'all to write this down in the comments. RHO. It's Rodelio Rosario. Rosea. We talk about this with the women. That helps as well. RHODIOLA. ROSEA. That helps with it as well. Beets, zucchinis, squash. Yes, yes, yes. Spanish moss, Spanish moss, Spanish moss, Spanish moss. Helps amazing. Miss Gigi, welcome, welcome. We talked about the female reproductive system, all the different organs, some issues with the reproductive system, such as infertilities, fibroids, cysts, breast cysts. We talked about PCOS. We talked about dysmenorrhea, meaning discomfort with urination. We went over some herbs, went over some exercise, how to tighten the vagina, how to moisturize the vagina, tighten the lips of the vagina, prevention of STIs. For the men, we talked about BPH, prostatic issues. We talked about infertility in men. We talked about erectile dysfunction, as well as called PRIAPISM. PRIAPISM means hardening for too long. So we talked about a lot of stuff in this live. So right now we're ending it. We're talking about the herbs. Thank you. We're talking about the herbs and everything here now. If you're just now tuning in, welcome to Higher Levels with Shay. I am a bachelor's degree registered nurse, 15 years in the medical field. 3 years as a certified herbalist. So I'm giving out natural remedies so that you all can take care of yourselves. This video can be found on YouTube at Higher Levels with Shay. So y'all can subscribe to my YouTube channel. Yes, Spanish moss. What's the word before Spanish moss? She said salmon omega. You said what was the herb for Spanish moss? RHODIOLA ROSEA. That's rhodiola rosea. Yeah. And for the men who are tuning in, you can use these herbs by drying it out. You can sun dry these herbs out. You can freeze dry them. You can put them in your teas, make them into a soup. You can make them as a seasoning. But myself personally, I find you get more potency when you make them into a tincture or a deconcoction, and you can use that. You can use white vinegar, distilled white vinegar. You can use glycerin to make into a tinctures. We're gonna go through how to make your own medicines at a later live. Right now, when I do my labs, I'm just tackling disease processes as a whole first, and then later we'll get into gardening, growing your own fruits and vegetables, and your own and how to make your own medicines. And for those skin rashes disease like psoriasis and eczema, I know how to make a wax for that as well, and we'll talk about how to make a wax to put on your skin, right? And how to use the herbs in that way. All right, now let's get into herbs for the prostate. Now, these herbs are not only for enlarged prostate, but also for prostate cancers. Okay, so get ready to write these herbs down, gentlemen and women. Sorry, I don't want to be discriminating. Cleavers, couch grass, cabbage, milk thistle. Yes, milk thistle. Reishi mushrooms. We talked about mushrooms already. No, couch grass. COUCH. Couch grass. Leeks. And leeks is more so like in a green onion family. They grow really, really, really long. They're very, very, very good with helping to decrease blood sugar, regulate blood flow, all of that. Saw palmetto. And false unicorn seal. All right. So we went over a lot in this lab. I hope y'all learned a lot. I hope y'all gained a lot. So when we talking about the reproductive system as a whole, do we have any questions? Any questions? Did y'all get those herbs down? Make those herbs to a tea. You can make them into a soup. You can make them into a tincture or a deconcoction. If you don't want to wait till my lab a few weeks now, you can just Google how to make a tincture. And, you know, just be successful. Again, guys, make sure that when y'all are writing down these herbs, do your due diligence and make sure that you are educating yourselves on these herbs as well. Could you give the website you gave 10 minutes ago? Yes, the website was www.YAFASHAKOOR, and they do deliver, and they have different teas to help with herpes and viruses and like hypertension. What else on there? The flu, just detoxing yourself holistically. They got beet juices on there, and not just a beet juice. It's a circulatory juice to help the circulatory system as a whole. Yes, so it's YAFASHAKOOR.com. That's the website. And make sure y'all please be sharing this information with your loved ones. Share this link, my page with your loved ones so they can subscribe and follow as well. Go to my YouTube channel and subscribe at Higher Level with Shay, because I will be posting this video. So women, if y'all missed it, or men, if y'all missed it and y'all missed fibroids and cysts and menstrual issues and infertility issues and hormone balancing and different herbs, how to tighten the vaginal lips, how to make sure your vagina doesn't have any odor, how to decrease your menstrual cycles when it comes to your cycle days and decrease the odor. You shouldn't have any odor. If y'all missed that, y'all missed a lot. I will be posting this. Yes, I'll be posting this on my YouTube channel. I can't post it here because it's too large. But on my YouTube channel, Higher Levels with Shay on YouTube, subscribe. And all my past videos I did. We talked about kidney disease, we talked about cancer. My last videos are on there as well. Yes. So you missed most of it that year. We went over a lot. We went over a lot. We went over different foods and different food processes, and just we got a little bit, we went into a lot. The steam, the vaginal steam, how to tighten your vagina, how to put the herbs in there to tighten your vagina. Yes. And make your vagina more lubricated. Yep, we went over a lot. We went over the urinary characteristics, especially for men. We went over infertility for men, sterility for men. We went over what your normal semen count should be, or sperm count should be, I should say. All of that is on this page. Go to my YouTube channel. I will be posting that. You can subscribe now to the YouTube channel. You can subscribe later, but just know that the content will always be there. I'm always providing this information on the YouTube channel. Yes, go to YouTube and it's going to be there for free. Just go to the channel and just go ahead and subscribe. And I will be providing it as well as my other videos that are already there. Yes. Tomorrow I'll be going live and we will be talking about diabetes. Diabetes type 1, diabetes type 2, and diabetes type 3. What is diabetes type 3? That is dementia. So that's what we're going to be discussing on tomorrow, okay? Diabetes type 1, diabetes type 2, diabetes type 3. I'm sorry, not diabetes type 1, diabetes type 2 and 3. We also did autoimmune disease on Saturday, but I think I'm going to redo that one because for those who did tune in to that one, I was a little, I did the lab, I did the education, but I was up for so many hours that I feel like my energy I could have had more to give. And so when I finished that lab, I think we did it for like 2 hours, guys. I just was still so drained, and I want y'all to get the best. So there was some information that I did forget to speak about in that lab, which is why today I made sure I wrote down little key notes. But the autoimmune disease, we went over lupus, we went over multiple sclerosis, we went over fibromyalgia, we went over a lot in that lab that we just did, and the different disease processes for that one. And y'all learned a lot. Y'all was liking and sharing and hardening. Y'all did and giving gifts, and I really appreciate that. For myself, I like to make sure I'm at my best when I'm doing this, so that y'all can really get the best and optimize y'all time when y'all are on here with me. And on that one, I think I was just a little bit like low in energy. I was a bit tired. Whether y'all noticed or not, I felt it. And so I just gave y'all enough information. I answered all y'all questions, but I look like, oh man, I didn't talk about this disease. I didn't talk about this. It was one particular young lady, and she personally inboxed me about one particular disease process, and I touched on it and I gave her herbs for it. But my intention was to really go into details about the disease as a whole and how to overcome that disease. And so I was just so exhausted that day. But I will be redoing it. I'll be doing a part 2, just a part 2 to autoimmune disease, because there was a few diseases that I did want to go over with you all. And but we was on it for like 2 hours already, and I was just exhausted. So that's why I wrote down all my key points today to make sure I hit everything, so that y'all can get the most of y'all time. And we'll go ahead and I'll post it to my YouTube channel. Okay. So what's the last link you said? The last link, was it the website? The website was www.yafaShakoor.com. That's the website. My YouTube is the same as this page here. It is Higher Levels with Shay. I am here Tuesdays, Saturdays, and Sundays at 4 p.m. Central Standard Time, covering different topics, giving out free information. I am on KP Radio and KP TV Mondays at 10 a.m. And I am on Just Faith TV at 5 p.m. Central Standard Time for the next 5 weeks. I've been asked to co-host on there for the next 5 weeks, talking about cleansing and detoxing the physical to get to the spiritual. And we're going to talk about the higher realm and talking about God and everything. So you can catch me on Just Faith TV at 5 p.m. Central Standard Time. That is on the Viry Network. Yes, you have a question, Caleb, go right ahead. I'm listening. Well, reading at this point. Those herbs, again, while Caleb is writing their question down, those herbs are, I want y'all to make sure that y'all do y'all research on it. I'm just giving y'all the herbs. It is your due diligence to do your research on the herbs, because some of those herbs do counteract with certain disease processes and they interact with other medications. So with the medications, make sure that you do your due diligence and understand what the benefits of those herbs and how those herbs work when it comes to your body, okay? Oh, the website, I'm too fast. I'm sorry. It is www.YAFA. So YAF as in Frank, A. And then Shakor, SHA. KOOR. So YAFA, S as in Sam, H as in horse, A, KOOR.com. All right. Thank you for the gifts. Thank y'all for the hearts. Thank y'all for the likes. Thank y'all for the shares. I greatly appreciate you all. Thank y'all for tuning in to Higher Levels with Shay. When y'all tune into the radio station, the TV station, we do play music on those stations. We will be interviewing people on those stations. And when I interview guests, I got guests who are going to be there who own businesses, who know how to tell you about business entrepreneurship, business grants, how to get business credit, building your personal credit, building up trust funds, generational wealth. I mean, we're talking about bishops, gospel artists. It's really, really, really great with the line that we have for the guests that will be on the radio stations, on the labs, okay? So y'all make sure y'all are tuning in. Thank y'all for coming today. If we don't have any more questions, one last call for questions before I log off. Do y'all have any questions? Why is all the men in the comments saying they're going to go run and get beet juice right now? Great. Go and eat healthier, man. But listen, don't just go and get beet juice, but then you still eating the fried foods and the processed foods and the alcohol and the Viagra and this is a lifestyle change. Because you won't be in my inbox talking about that lady said drink beet juice only. No, this is a lifestyle change. Because a lot of men in the comments running, so they're going to drink beet juice 3 times a day, 6 times a day, run and get beet juice. Now somebody said something about beet juice jerky. I've never heard of beet jerky. But what I will say is this. My name is on YouTube is Higher Levels with Shay. Gentlemen, do not go and still be eating the same type of food, living the same lifestyle, and drinking 10 cups of beets a day. It is still your responsibility. The beet chips, as they said, beet chips. What I eat, yeah, beet chips is good, But listen, it is a lifestyle change. The same thing with women. I don't want y'all to be sitting there doing the vaginal steam, and then you still put all the toxins in your body. I know it's going to happen in moderation. I didn't change overnight. It took me some time too, but I started making the change, and that's it. And give yourself some grace. I stopped eating beef first, then beef and pork, then beef, pork, and lamb, then beef, pork, lamb, and chicken, then beef, pork, lamb, and turkey. And now I'm just down to my seafood, and I eat that every now and again. I'm more of a fruit and vegetable type of person. And you can still have a very great life. You can still eat your greens and your broccoli, your potatoes, your rice. And I heard one herbalist who's been she's been a certain earth about 15 years. She's like, that rice and isn't good for you and all that. And my thing was, listen, even if I'm taking the knowledge and I'm still learning as I'm going along. I'm still making a change. So I heard from one herbalist who's been doing a lot longer than me say that even rice isn't good for you. Right now, I still eat rice until I continue on with my journey. You see what I'm saying? You can't just cut off everything at once. So I'm giving myself grace, and I'm right here with y'all. I'm right here with y'all. So let's just keep making the steps together. Okay. Somebody said rice and potatoes are not good for you. No adults, emojis. Y'all know everybody's saying the rice isn't good for you. Like wild rice isn't good for you. They like, no. Brown rice isn't good for you. They like, no. So I'm like, oh wow. Well, I put rice in my steamed broccoli for right now. I don't eat it a lot, but I still eat it. Taxis is horrible for you. What is it? What taxi? What do you mean taxis are horrible for you? I don't know what that means. Yeah, so when I say do a lifestyle change, I don't expect you to change overnight because I didn't. But I absolutely made the gradual change, you know? He said, what are we supposed to eat then? You're supposed to eat your own food, grow your own food. Oh, Takis. Yeah, Takis is disgusting. That's bad for you. Grow your own foods. Eat your own foods. They actually have fruits and vegetables that mimic the very meats that we eat. Like a lot of the mushrooms actually mimic lion's, not lion's mane, reishi mushrooms. It mimics the chicken. You know what I mean? It mimics chicken. And you can, and like lion's mane, turkey tail mushrooms. Y'all eat portobello mushrooms, soy. And not a lot of soy, because a lot of soy can help increase your estrogen level as well. But soy, there's things that you can eat without it being processed. Make your own noodles. Make your own pasta. If you don't know how, learn. The whole point is to want your ultimate goal is to be self-sufficient. You're not going to become self-sufficient overnight, but at least you can start the transition. So it's not what are we supposed to eat, it's what are we supposed to do to help ourselves be better? What are we supposed to do to make ourselves self-sufficient? Grow your own lemon tree, your own lime tree, your own, grow it. Get some grow bags. Put it in the garage with the UV light. Put it in a closet. Make a personal room in your house, your grow room. You see what I'm saying? Invest in oneself. I eat a lot. I look extremely healthy. I eat a lot without me having to go and run and depend on this GMO manufactured man-made food and have to depend on processed foods. I eat a lot. So you can still eat a lot of food. And for those who eat fish, don't eat fish, start fishing. Teach them how to fish. Go to your local farmer's market. Thank you. You are a blessing for God. God bless you. You as well. I appreciate your journey, divine, feminine, and continue to spread awareness and insight. Self-sufficiency keeps you fit. Absolutely. Thank God for you. Can't eat vegetables alone all the time. You don't have to. Oh, please. Chinese rice, I eat it all the time. Yes. Thank y'all. I used to go crazy on those. Self-sufficiency is the key. It is the key, and it keeps you fit. Yes, it does. It keeps you fit. It keeps you fit. Yes, it does. No Pop-Tarts, no artificial foods, no processed foods, cereal, those instant oatmeals and stuff. It's not real. It's not real. It's not real. And somebody said you can't eat vegetables all the time. I mean, you do, because you put vegetables when you eat a burger, you put tomatoes on it, you put lettuce on it, you put seasoning and herbs on it, because you yourself can't even eat that meat in its rarest form. So you're eating vegetables even when you're eating a burger. When you're eating a hot dog, you're putting relish on it, you're putting ketchup on it. Ketchup is paste tomatoes. So yeah, you are eating vegetables all the time. It just sounds weird when you take away the meat, because we've been so programmed and conditioned to think that we need meat. And we don't. And we do not. When you eat a salad, throw some pecans in your salad. Throw some apples in your salad. Trust me, I bet it tastes amazing. When you're eating a wrap, you can eat some beans and put it in a wrap. You won't even miss the meat. It's all about the seasoning. It's all about you being able to cook. It is. Exactly. Great. Oh, great. That sounds like a good meal. That sounds delicious. Spinach, veggie enchiladas, and brown rice. That sounds delicious. If y'all remember back in the day, they used to have where meat was a luxury. Back in my great grandma's days, they had where meat was a luxury, where they ate meat only once on Sundays. They ate fruit, vegetables, and salads all week long, and then on Sundays they ate meat. And then it's either like, okay, you can either accept the knowledge or save it for later. I won't say ignore it, but it's gonna plant a seed. And one day that seed is gonna sprout. And you're gonna come to Higher Level Shay YouTube channel, and this video gonna be right there for you. And I'm gonna welcome you with open arms. And tell you, give me a hug and tell you I love you. Is it okay if my herbalists come up in the box? Your herbalists come up in the box. Do you have an herbalist with you? The life of you is your stomach and your mental health. Yes, it is. Yes, it is. What we put in our mouth nourishes our entire body. What we put into our mouth nourishes our entire body. Our stomach feeds our brain first. You see what I'm saying? So what you put in your body absolutely has something to do with your mental health. You know that parasites in your body can lead to mental health disorders. And people think they have schizophrenia, paranoid personality disorder is really just a parasite they need to just get rid of. I mean, there's a lot of things to cover. That's why I said next Sunday, I don't know if we want to do mental health issues or do we want to do autism and childhood diseases. So I don't even know, but that is absolutely correct. Yes. Yes. Men, do y'all have any questions about the male reproductive issues? The women was in here with all type of questions in the conversations. The men got what they needed and said, all right, thank you, ma'am. No questions? All right, then. Well, guys, I thank y'all for tuning in. I will see y'all tomorrow at 4 p.m. We will be discussing diabetes and pancreas. So thank y'all for tuning in to Higher Levels with Shay. Make sure y'all go to my YouTube channel to check this video out if y'all missed anything. And make sure y'all follow me on Mondays at KP Radio, KPTV at 10 a.m. And on Fridays for the next 5 weeks, I'll be on Just Faith Television. So see y'all. Have a blessed day. And I'll see y'all tomorrow.
Where and what you mean by estrogen annihilation?
Estrogen can be used as a synthetic or non-synthetic hormone. We can call this an inorganic hormone or what you'll call melanin neurotransmitter, because it acts as both depending on what tissues is in the body, or it can be or organic melanin neurotransmitter. But basically what estrogen is a cellular proliferator, meaning it brings life and growth to a cell, but it comes in a balance with testosterone to keep it balanced. If it's too high, then it starts growing things that shouldn't be grown. Let's just talk about a female.
That's why little dudes get breasts and all that.
It's called visceral fat. So, but this is good on a woman. It's just bad on a man. So what I call estrogen annihilation, we could talk about it in a woman's sense and in a man's sense. What it does in women is it grows fibroids. So a woman go on a menstrual cycle, right? Every month she bleeds. She bleeds to actually shed what you would call a corpus luteum, or that egg that was supposed to be fertilized by her uterine wall. If it's not fertilized, then what it does, it goes through the endometrium lining of her cervix and it starts to shed off. This is called her period. Well, it's a cyst that grows comes in and it grows a cyst. The cyst is actually supposed to be fertilized by an egg, by the ovary. So if you have sex, if a woman has sex during her ovulation period and a man ejaculating her, the sperm then travels. It goes through this tremendous fight. Then one of the sperms, which is crazy in itself, then one of the sperms actually make it to the egg. Inside of this egg is the corpus luteum. This is the cyst. This is actually what's really being fertilized. But if the woman don't have sex, or if she don't go through her ovulation period and she don't get ejaculated in, then this cyst is supposed to be broken off by something called progesterone. Right now, progesterone don't come in and break that corpus luteum off. What happens is it's because it's too much estrogen in the body, because of things she eating. She might be interacting with the sun and the moon different, because that plays a major role in a woman's menstrual cycle. Yes, the sun and the moon and the stars play a major role in a woman's menstrual cycle. Well, anyways, estrogen start producing in the bloodstream too much, and it will start feeding that particular cell. So remember, estrogen is a cellular proliferator. So it starts growing and growing that cyst. So that cyst become a bigger cyst. Then that cyst literally starts turning into all other types of things, of what we call fibroids, or polycystic ovarian syndrome, where there's multiple cysts on her uterine wall or inside of her cervix. These things are very, very bad for the woman, because it kills the body. They grow teeth, they grow hair, and then they start stripping the blood of iron. Sometimes they even create their own bloodlines, their own bloodstream. They literally create their own blood vessels. It's called angiogenesis, where the tumor, or what you would call the fibroid that was built by estrogen, starts getting so big that it needs its own blood supply, that this deal will grow its own blood supply. It's called angiogenesis. They grow teeth, they grow eyes, they grow hair. Because remember, the corpus luteum was supposed to turn into a fetus or an embryo, but it never did, because you didn't get ejaculated in. Showing you too that women can get pregnant by themselves. I'm just saying, when you really look at this, a woman can get pregnant by themselves through the corpus luteum. They growing teeth, they growing hair, eyes, and everything, and wasn't ejaculated in. How was this thing forming into a baby when there was no intercourse? We got to ask ourselves these things. But anyways, so we see that it does that. Now in males, and remember estrogen, so all of these estrogen, pregnenolone, progesterone.
Hold on. Yeah, I want to go on this fibroid thing some more, right? I know it's really affecting Black women.
Yeah.
Why is it affecting Black women more than white women?
Because the biodiversity of bacteria and the way we utilize chemicals is different than so-called Caucasians. We have to understand that we are not only externally different, meaning our pigmentation is different, meaning they grow straight hair, their hair grow towards the ground. We grow kinky curled hair, not ether hair. Our hair grow towards the actual sun. But our genetic makeup, our molecular structure is different. The biochemistry of our body is different. The biodiversity of bacteria in a Black woman's vagina cavity is very different than the biodiversity of bacteria inside of a white woman's or Asian woman, so-called white woman, so-called Asian woman. The salivary glands, we produce alkaline salivary alkalining enzymes in our mouth. Theirs is hot enough to break down certain meats and stuff. Again, the hydrochloric acid in our stomach don't get hot as theirs, so they can break down polypeptides and these peptide chains, or what you call meats. Ours can't. Everything about our molecular structure is different from every other specific race and genealogy here on planet Earth, but a lot of people don't talk about it. And that's why you see, basically ethnicity related diseases is high amongst a certain ethnic group. So if you see that so-called African Americans are high in, diabetes, high in hypertension, high when it comes to stroke related diseases when they get older, high in STDs, but you look at every other race and theirs is not. You have to start sitting back and asking yourselves, what is it about our molecular structure that's different from theirs? So we just have totally different molecular structures. We have more diversity of prokaryotic cells in our body. They have more diversity of eukaryotic cells. Prokaryotic cells were here first over 7.1 trillion years ago. Eukaryotic cells came a few.
Once you try a comfort hoodie, you can't go back to regular hoodies. They're slightly weighted, super oversized. It's that perfect fit that makes you feel like you're wrapped in a blanket, but you get to look like you have your life together.
Few trillion years after that, after prokaryotic cells evolved into eukaryotic cells. So we come from prokaryotes, they come from eukaryotes. We are totally two different people, meaning that when we react to our environment, it's going to have a certain chemical exchange in our body that is going to be very, very different from them.
Is that one of the reasons with this lactose thing with Black people?
Yes, all Black people, all so-called, I hate the word Black because it's color of gray. All melanated people are lactose intolerant. We can't digest any other mammal's milk. Only milk we were made to digest is ours. And it's a reason why, because we are simple creatures and we need simple amino acid structures. We need simple sugars called monosaccharides, not polysaccharides. So when you which is a person that needs monosaccharides or high energy, go and suck on the tit of a mammal that's not your mother, whether you're doing it from a milk carton or not, you're still sucking on the tit of another mammal or another species. It does something to the molecular structure where your body tries to purge that sugar out. It's called galactose. So the body don't need that galactose. Your body only want the galactose from your mother between the ages of 1 and 3. After that, your body will do the same thing to your mother's galactose, because now you're being introduced to a newer sugar. So what happens is the body goes through a detoxification phase. First thing you get is bubble guts and what? The runs, right? The guts start rumbling and you got to go to the bathroom. That's the body having a natural capability of healing itself and knowing that these substances in our body is too foreign to the body. So the body is miraculously heal itself. It's going to give you diarrhea where you can go get rid of the poison that you just put in your body. And then you have to think about what this milk is for. When you look at cow's milk and you look at goat's milk, a goat can get up to 500 pounds. A cow can get up to 2 tons. It can weigh more than a vehicle. That means that milk has so many fats, so many steroids, so many amino acids, so many of all these different bioflavonoids that is made to build a 2-ton weighing mammal. And we're putting our children on it. And we wonder why our children is obese. Our children, you put them on milk or you put them on Similac and all these, because most of these Similacs that the government is giving them is growing them. So you see a 6-month baby that look like he 3. Because the milk, only thing the milk, it ain't the milk fault, it's our parents' fault. The only thing that milk is constructed to do is to build a 2-ton animal. And you giving this milk to an infant. And you wonder why the infant is overweight. You wonder why the infant have different neurological reactions, because we know that food feeds the brain. You wonder why that they get very, very antsy and very aggressive when they see a bottle. Same thing that a cow do. I just want you to do this when you get a time. Study how Similac babies act towards food and how organic breastfed babies act towards food. Get them ready for a baby. It grows their breasts. It makes them more sexually attractive. For a man can look at the woman. And that's another thing. A lot of women are now saying that, all men want is sex. I mean, on a primitive level, that's all men's supposed to want. A man look at a woman, he look at how sexually attractive she is. The first thing he think of is reproducing. We think sex is something else, which it is when you get into the higher spiritual realms, but it's for reproducing, entering to the course. So of course a man is going to look at you and see a round behind and see some plump breasts and want to make love. It's in his entire DNA to repopulate, to make sure that his genealogy is living forever. So anyways, so in women, it's supposed to get her ready for reproducing. And males is supposed to do the same thing, but too much of it in males. Remember, you have adipose tissues, and these adipose tissues in males starts over accumulating where it can make sure it holds in estrogen. So estrogen in men is supposed to kick on testosterone when it's at a little, but when it's too high, it overpopulates testosterone and it makes testosterone go low. Testosterone and zinc and iron phosphate and magnesium is actually what creates seminal fluid. Seminal fluid is then goes into the prostate and it creates your ejaculation fluid for you can have semen, for you can actually have a baby. So estrogen lowers your semen count. It sterilizes you. Not only that, it grows visceral fat, meaning that it literally can grow breasts, or you see a lot of men getting butts now, and it shrinks the penises. We have lost over 2 inches in width and girth of penis in black males within the last 10 years. We're losing our penises. All right, well, not only that, estrogen, it messes with the DNA, and now a lot of males are losing something called the Y chromosome. If you look at embryology, when an embryo turns 6 weeks, that determination factor is when, because all embryos starts off phenic. They all starts off as feminine, females. Then at the 6-week mark, if a Y chromosome is added to the X chromosome, that's where you get an actual male from. Well, we are starting to lose that Y chromosome, and scientists are just now figuring out why. It's because the overpopulation of estrogen that men are taking. So now you start looking at this vegan movement. The vegan movement, where they pushing all these synthetic estrogen burgers, synthetic estrogen meat, synthetic estrogen corn, synthetic everything got estrogen. They pumping estrogen into everything. And we don't see what they're doing. They even putting it in meat now. They're putting sexual estrogen hormones in your chickens because chickens are not growing fast enough. Remember that estrogen is a cellular proliferator. It grows things just like L-arginine and L-lysine. So what they do is if a chicken is not growing fast enough for them to be able to put it on a production table for what they call them, hot wings, and all for all these different restaurants can have their hot wings for us to eat. In order for them to grow fast, to have quick production, quick production, they pump them with sexual hormones.
So it's a steroid.
It's a straight steroid called estrogen. And steroids are made by something called cholesterol. So you can even get these steroids if you wasn't in the sun, because it's all synthesized by something called vitamin D. And the only way you can get vitamin D is by tyrosine and melanin converting with the sun. So plants go through something called photosynthesis, and we go through something called biosynthesis.
I wanna be with you always, 'cause that is what my heart says. That's what my heart says. I wanna be